Hi everybody, I am Dr. Sathya. Today's subject is don't medicate, we try to eradicate. We will go to details. To begin examining how the type 2 diabetic can be healed, we need to look at how it developed in the first place. As mentioned, the heavier you are, the greater your risk of developing type 2 diabetics. For some, even a small amount of excess fat on the body can trigger diabetes. Your body cells are fueled primarily by the glucose. Insulin is the hormone messenger produced by the beta cells in the pancreas, which induces the glucose's uptake into the body cells. Glucose cannot pass into the cells until the insulin opens the gate. However, as little as 5 pounds of excess fat on the frame can interfere with the insulin's ability to carry glucose into your cell. When you are excess fat on your body, insulin does not work as well. And then the glucose has difficulty in entering into the cell. The fat on the body interferes with the action of insulin through multiple mechanisms. The free fatty acid released from the fat cells is one of the mechanisms promoting insulin resistance in liver and muscle in a phenomenon known as lipotoxicity. The excess of circulating fats in the bloodstream also blocks insulin binding on the outer membrane of the cells and interferes with the normal muscle function and energy production. When the cellular energy production is slowed, more insulin is required. This lipotoxicity can affect the heart as well, promoting an irregular heartbeat and increasing susceptibility to heart failure. Fat cells also produce binding proteins to attach to the insulin hormone, blocking its activity. Some of these fat cells produced molecules are also cause muscle cells to be desensitized to the insulin. If it is not bad enough, when our cells membranes are impregnated with dietary trans fat and saturated fats, the insulin binding sites are disordered, impairing the insulin from binding to the docking station of the cell membranes, making insulin less effective at enabling glucose uptake. To overcome all these issues, your pancreas must produce additional insulin. With significant weight gain, the insulin-producing beta cells in the pancreas become dramatically overworked. In short, type 2 diabetes is a disease of heightened insulin resistance, not one of absolute insulin deficiency. Insulin works less effectively when people eat fatty foods, overeat fat, low nutrient foods, or gain weight. So when people are overweight, they require more insulin, whether they are diabetic or not. But giving overweight diabetic people even more insulin makes them sicker by promoting further weight gain, causing them to become even more diabetic. How does this process work? Our pancreas secretes the amount of insulin demanded by the body. The people of normal weight with about 1/3 of an inch of periumbilical fat will secrete a certain amount of insulin. But what happens when they gain 20 pounds of fat? Their bodies will now require more insulin, almost twice as much, because of fat on their body interferes with the uptake of insulin into the cells by the various mechanisms. The body fat deactivates insulin and raises blood glucose. Free fatty acids circulating in the blood have a toxic effect, inhibiting energy production from the muscle tissues, which then demanded more insulin. The fat cells produce pungent epithelium-derived factor, causing cells to desensitize to insulin. The fat cells produce retinol-binding protein, which prevents the insulin from activating glucose-carrying proteins. The trans fat and saturated fats can stiffen and distort the membrane located in the insulin receptors, interfering with the efficient binding of insulin with the glucose. When people are significantly overweight or obese with more than 50 pounds or excess fat weight, their bodies demand huge lots of insulin from the pancreas, even much as the 10 times more than the people of the normal weight require. What do you think occurs when 10 or more years of overworking the pancreas so hard? Of course, it becomes exhausted and loses the ability to keep up with the huge insulin demand, and less insulin is produced. Eventually, with less insulin available to move glucose from the bloodstream into the cells, the glucose level in the blood start to rise. And those people are diagnosed with diabetes. In most cases, these people are still secreting an excessive amount of insulin compared to a normal weight people, but just not enough for them. As time goes, or even them, the overworked pancreas may still pump out more and more insulin than a thinner person might need. It won't be enough to overcome the effects of the disease causing body fat. I call it pancreatic poop out. Some severely overweight individuals have a large pancreatic beta cell capacity, so they can produce high levels of insulin without become diabetic. These high insulin levels in the blood are strong predictor of heart attack risk and lifespan. So whether these people are diabetic or not, their high insulin levels are still dangerous. In fact, insulin level is a better indicator for a future heart attack, than a cholesterol level. Often people will be an emergency room with their first heart attack and be told for the first time that their sugar is elevated. These heart attack victims never knew they had diabetics. The first sign of it was the heart attack from years of having heightened insulin level. Damage was building up before the elevated glucose became apparent. In most cases, the pancreas' ability to produce insulin continues to lessen as the diabetes and the overweight condition continues years after years. Unlike the type 1 diabetics, the total destruction of the insulin secreting ability almost never occur in type 2 diabetic. But sooner type 2 diabetic lose the extra weight that is causing the diabetes, the greater the likelihood they would be able to maintain a functional reserve of insulin secreting cells in the pancreas. What this means is that the typical type 2 diabetic is caused by excess weight in the individuals who have a smaller reserve of insulin secreting cell in the pancreas. As the statistics are showing, type 2 diabetic is a growing epidemic. But what is surprising is that the people suffering can range from anywhere from 10 pounds overweight to a significantly obese. It is important to say here that the individuals who are susceptible 10 to 20 extra pounds or kilos of fat can lead to diabetic symptoms. No matter what the number is, losing of excess weight enables these individuals to live within the capabilities of their body. Most type 2 diabetes still produce enough insulin to maintain normalcy as long as they maintain a favorable body fat percentage. Simply put, since the level of insulin in your body is a good indicator of your risk of heart attack, and since the tape measure around your waist is nearly as good an indicator of insulin levels as a blood test, it makes sense to remember the ancient saying, the longer your waistline, the shorter your lifeline. Following a nutrient-rich, lower-calorie diet, a nutritarian diet, coupled with a good exercise program is the most important change you can adopt to extend your lifespan. It has been known for years that intentional weight loss improves blood sugars, lipids, and blood pressure in diabetics. Gastric bypass surgeries and other procedures are risky, lead to the malnutrition, and most often produce only temporary result. Nevertheless, overweight individuals who go through the gastric bypass surgery and become too uncomfortable to eat much often also resolve their diabetics. Over the years, as the stomach stretches and the weight returns, these individuals can become diabetic again. Unfortunately, they did not learn enough about nutritional excellence. A recent study documented a significant increase in lifespan with an average 25% reduced mortality when a diabetic individuals drop their body weight by just 20 to 25 kilos. So imagine the results when a program of nutritional excellence achieves the weight loss and the body cells are flooded with micronutrients and fuel cellular repair. Scientific literature shows it is not just the body weight reduction is that enables diabetic reversal and recovery, but also the high levels of plant-derived micronutrients and phytochemicals can fuel the body's own remarkable self-healing properties. The results you can achieve within a nutritarian diet are predictable and remarkable, but it takes some effort and time. Lowering the cholesterol and reversing diabetes, it is the gold standard when practically for people who want to do what is the best for their health and give it, they all become non-diabetic. A nutritarian approach is all about a superior nutrition, not just moderate improvement in diet. Moderation doesn't work, but not to worry, as already mentioned, nutritional excellence will make your taste buds happy and you will be more than satisfied with the amount of food you can eat. I'll be back with a subject which the help our diabetics to be managed in a better way. Thank you.